Hello, everybody. Susan Kellner-Zinck with Dawning Visions Hypnosis. Thought of the day. You know, I find it incredibly ridiculous that some people believe that they're capable of healing their own emotional traumas. And I say this because I speak to a lot of people on Alignable. I do at least 1 to 3, sometimes 4 Alignable Smart Connects a day because I live in Albania and it's my evening nighttime. So after client work and schoolwork would be done. And so many of them are sitting there telling me, well, I've been working on this for a really long time. I think I got it. I'm almost there, blah, blah, blah. Let me tell you something, folks. If you actually are finding yourself ruminating about the same old crap over and over again, procrastinating on the things that you need to do in your life, especially when it comes to providing a living for yourself or having those hard conversations with others, or you're finding yourself feeling negative emotions, anger, sadness, fear, guilt, shame, and especially those of you who are triggered by every normal thing another person may have to say because, I don't know, you never healed your own crap. Yeah, I'm speaking to you mental health providers as well. You know who you are. There's a reason why this cannot be done on your own. And it's really simple. Because you cannot see the things that you're blinded by. Pure and simple. Our subconscious mind is there to protect us. And sometimes, most of the time, it creates protective defense mechanisms that create this dysfunctionality in our life, be it our negative thoughts, negative emotions, self-harming behaviors, whatever. And I'm here to tell you that just knowing why you do the things you do and not doing the things you're not doing is not going to help you to stop those particular activities from happening or not happening. It will not. I can promise you this. What you need to do is find out the cause of the problem. Why did your subconscious mind develop these defense mechanisms? What is the purpose that they serve? In other words, why are they continuing even though they are detrimental to your life overall? And couple that with something called a compelling future. Because if you actually have a future that's really important to you, something you truly care about, and I don't mean just being there for your kids and leaving a bunch of money or whatever. By the way, that's a really bad idea. Don't leave money for your kids. Let them earn their own money. It's about making the world at large better for your having been here. Getting involved in something in this world that is really meaningful to you, something you care about, heart and soul. That is what we mean by a compelling future. And if you have a compelling future that's big, guess what? All of a sudden, you're willing to do whatever it takes to heal all that garbage in your subconscious mind and move on with life, knowing that these things were just happening, no big deal. You've moved on. And I'm here to tell you that I've helped people who have had horrific experiences in their lives. I have one client who was put into inpatient at the age of 5.5. At 7, he was put in 4-point restraints in this program because they were trying to control him and his behavior. He was really angry. He had a good right to be angry. And let me tell you something. That's not legal, at least in the state of Massachusetts, for many, many years now. But that's what happened in the state of Massachusetts when he was in the inpatient. The abuse this kid took from the mental health system is deplorable. Never mind giving him 6 diagnoses, not one of them which actually had anything to do with his life in reality, and had him on 6 medications to the point where his body was basically shutting down. Not to forget to mention that his lovely family psychologist in that program told him he'd be dead or in jail because of his behaviors. Yeah, And that was a state licensed person. Not kidding. Very sad, very deplorable. So I don't know if that's the way that I would tell anyone to go. But what I would say is that we're not able to do these things on our own. I know that I was in conventional therapy for 14 years for what we would know as manic depression back in those days, bipolar 2 these days. Luckily, I never had any psychotic breaks. That was the excuse given for putting me on so much lithium that I couldn't function. Had to bring my ex into a session to tell the psychiatrist, but she would not hear from me for 6 months of sessions. It was ridiculous. But she heard him. And then the following month, I put the words in his mouth again, and the meds got lowered again. And then finally, I got a psychiatrist who was actually able to listen to me and hear me. But even she couldn't help me get rid of the problem. Timeline therapy with Tad James, 5 minutes. Knowing what negative emotions needed to be released did the job. And yes, she did follow me for 10 months after that. Just to make sure I was okay. Because no one goes off medications without knowing that you're okay for a while. Got to test it out. Don't want to be stupid about these things. Especially in a situation where I am here taking care of other people. I need to know that I'm doing my best work with them. Now, another thing that I'd like you to know is that if you are seeing a person currently and all they're doing is validating your feelings and not giving you any tools and techniques to help you to move on in your life, this is a problem. It's a problem I hear about a lot from clients who come to see me, and also a lot of people on CORE complain about therapists who don't help them at all. It's important for people to have tools and techniques. It's important for people to know that you're hearing what they're saying. You know, if you're seeing a therapist and you don't feel they're hearing you, find someone else. I have my prices in the description, and I'm not cheap, but I'm a hell of a lot cheaper than seeing a therapist for 20 years, even at $30 a pop, plus the health insurance you're paying, because you won't have your problem if you fit within the scope of my practice. I cannot help people lessen psychotic events, and I can't help people who have full-blown personality disorders, but I did help a guy who had some symptoms of personality disorder to be able to create really great friendships. He was able to rebuild his business, and he dropped, I think he said 80 pounds in the 4 or 5 years since we did the work together. He sent me an update on a Facebook post that I did on anorexia. And he did admit that he didn't see the video, but he did put in a really good plug for me, which is really, really nice, because that's what you want, folks. You want to be able to heal and move on in life. And we can't do it ourselves. We need to have competent people there to listen to what we're saying, what we're not saying, between the words and what we're saying, to hold us responsible. We're talking out of both sides of our mouth, meaning that the words that we're saying are contradictory. And that happens more often than you want, because your conscious mind is telling you one thing, your subconscious mind is telling you another, and that's how you get that to happen, which is why going to a hypnotist is a really good idea. If you have a hypnotist who actually knows what the hell they're doing. Like in most things, not all hypnotists know what they're doing. And just so you understand, I did work in conventional mental health for several years before I ever got into hypnosis, and I healed my crap before I ever did that. I'd never be working with a person in this way if I hadn't cleared my stuff to the point where anything or that they could say could ever trigger me. Nothing my clients say ever triggers me, and I do hold them accountable. And I am in the face when they need it. Because let's be honest, some people don't listen so well, and they want to argue for being ill and to remain the way they are. And guess what? It can't grow if that's the way you're going to be. And there's times when you have to be very kind and considerate and loving and caring. And you have to know when those times are, because those times can happen with the same patient in different times. In my case, clients. I don't have any patients. I'm not licensed. By the way, hypnotism and neurolinguistic programming are not licensed in the United States of America. They are not licensed professions. So anyone who tells you they're licensed means they were licensed to use somebody else's technique. That's very different than being state licensed to practice. Okay? So let's be very clear on that. I want to tell you these things because we all deserve to have happy, contented, fulfilled lives. But you can't do it until you learn what you need to learn about your past, reframe it in a positive way so that you can move on without that stuff getting in your way anymore. That's what has to be done. And you can't do it yourself. I'm sorry. You can pretend all you want, but you know if you're stuck in the same cycles over and over and over again. You live in it. So to sit here as one person who I had a consultation with not too long ago, well, I've overcome a lot of stuff and, I'm still working stuff out. Well, great. You'll be working out stuff for the rest of your life because you're still working out stuff for the last 40 years of your life. When does it ever end? That's another thing. How much time, how many years do you want to lose to feeling these feelings you have, unable to do the things that are important to you because you are incapable of getting beyond the things that are causing distress in you right now? You can't get the time back, and I'm going to tell you right here, right now. From age of 33, I lost a lot of friends and acquaintances over these last 3 decades. I'm 63, so it goes back 3 decades. The first one was a brain aneurysm. He left a wife 6 months pregnant. Another one lost her life visiting family for her sister's wedding. She was on a jet ski. The thing tipped over, instantly dead. Thing ended up on top of her. Later on, cancer took away a few other people that I know. Young, breast cancer, 42, gone. My best friend was getting a stent put into his heart. He didn't even know he had heart disease. No one had diagnosed him, although it shouldn't be too shocking since his brother, at the age of 50, died of a heart attack secondary to his type 2 diabetes. And my friend had type 2 diabetes, and he was not doing what he knew he needed to do to take care of it, which is all too often the case with people in healthcare. He was a case manager, actually, for developmentally disabled people. He got awards for the work he did, but he wasn't capable of taking care of himself. Who do you want to work with? Someone who's taking care of themselves, or someone who's just going to dictate to you what you need to do and they don't do it themselves? That's really important when you're choosing somebody to work with. So I want you to understand, asking for help is a really important thing to do. It can save you years of distress. It's very impossible to be happy when you are feeling distressed. It's the definition of unhappiness. And it is a challenge for us to look at ourselves, but I can tell you this too. When you're using hypnosis, you're going to the subconscious mind. I actually bring it to your higher conscious mind to get the subconscious mind and all of its protective defenses out of the way, making the work easier and quicker. Even if you do have some kind of bad reaction, you get upset or whatever, you make sure that's all healed before I end the session, and my clients feel lighter and brighter. And that's what I want for all of my clients after each session. My sessions don't last 50 minutes. It lasts, especially in the beginning, 2.5 to 3 hours, because we have to get to a certain point in the treatment plan where I know we've covered a certain amount of information to clear the amount of information necessary to help a person feel a lot lighter and brighter after the session, because that's how they know they're getting results. But the end result is to have a life that you are enjoying, because that's what we're here to do, to enjoy life, right? That means doing work that matters to you, having healthy relationships, first with yourself and then with other people, doing the hobbies that you really want to do. I can't even tell you how many people I talk to who say they want to travel. You know what I tell them about travel? You buy a flight. It's that easy, people. And then you learn along the way the places you enjoy, the places that you don't enjoy, cultures that you enjoy, cultures you don't enjoy. It's going to be different for each one of us. And I suggest people go to Eastern Europe and to Morocco, because they're very inexpensive and they're not dealing with a lot of the tensions that are happening in the Western countries now in 2025 as I record this or do this live stream. So I hope you found this to be very valuable and to really think about what I told you. If I'm humble enough to tell you that I went through all this care and finally found my way out of it, maybe you can cut a couple decades of feeling like crap out of your life by getting help from the right person, so you can also move on in your life. But you have to make a decision that you're worth it. And if you're not worth it, do it for the people who you love, like your children who really need a mother or a father who can be there for them in a loving, unconditional manner, for an example. Or a spouse who really loves you and wants to see you thrive, not just exist. As always, I thank you for spending your time with me. Till next time. Bye-bye.